This is the Fox 11 10 o'clock news.
In the wake of the shooting, a blog post by a mother of a mentally ill child is all over social media. It's called I Am Adam Lanza's Mother, and it shares the mother's story of being afraid of her own son. The post tells the heartbreaking story of this 13-year-old boy who she calls by the alias Michael, and how he has on numerous occasions threatened to harm his family and himself. She calls him brilliant, but is terrified of his out-of-control rages. She's had very little luck getting help for her boy, has at times been forced to call the police to help. Taking issue, though, with that blog is one expert, the head of Didi Hirsch Mental Health Services. Dr. Keita Curry has been in the trenches leading the way toward understanding of mental illness. I asked for her perspective, starting with the woman who wrote the blog. I want to ask you about this blog here. She says, I am Adam Lanza's mother. What do you think about that?
She's speaking as if she and his mother had the same issues and the same problems, and also sort of implying that her son's problems are those that Adam had, and we really don't know that. In fact, I mean, the little I've read, he was a quiet, calm boy.
It's a call to action. America's saying something's clearly wrong here. What can be done?
Well, first of all, we have yet to find a way to predict who will be violent. And so when we say something needs to be done, we're assuming that we can predict who will be violent, and if we treat them, everything will be okay. And that's just not the way it is. So we would be better off to treat everyone that seems to be suffering and having a problem. And for 59 million of them, they're never going to do anything violent. In fact, violence is much more common among people that are abusing alcohol and drugs. We're focusing on one possibility, that he had a mental illness. He may have had a mental illness. Certainly he may have. He may have had a mental illness that caused him to do this or was contributed. He may have had a mental illness that had nothing to do with this. They're both possible. But when we only talk about mental illness when something bad happens, we imply that with the correlation comes causation, and we imply that people with mental illness are dangerous, someone you wouldn't want to associate with, someone you wouldn't want to hire, someone you wouldn't want to be. And so now people that are suffering from depression or obsessive compulsive disorder are going to be less likely to go to get help or tell their friends. And it's only when we talk and we live among people that we reduce discrimination.
And Carlos, really, that's her big concern. She wants people to know that they can talk about this and come forward. Dr. Curry, she also expressed a concern about violence in the media, including news coverage. She'd like greater discussion in general on mental health. Didi Hirsch runs 11 centers, and they also run the suicide prevention hotline.
And there's always that danger that we've seen of copycats, and we've actually told stories about that today, and it continues on, and it's a major, major concern in the mental health care community.
She really did, yes.
Well, the city of Newhall near Santa Clarita